Welcome to this video, whether it's your first time or you've been here many times before. Always welcome. Now, this is a bit of an update about the United States, and of course the obvious thing to think about is the condition of the president. So let's just jump straight into that. Basically, we want to see how likely is it that the president's going to make a good recovery. And we'll see, to give you the bottom line, that it's overwhelmingly likely he should make a very good recovery. But let's look at the facts on that. Because on this channel, if you're not familiar with us, we always try and go from the evidence in published scientific papers as much as we can. And then we try and reason a bit from that to make sense of what's going on. So that's where we're at. Now, Mr. Trump is 74. Melania, his wife, is quite a bit younger. Now, the president has tweeted, "We will begin our quarantine and recovery process immediately. We'll get through this together." So that's a fairly positive sentiment. Now, all the news outlets at the moment are saying that the president is feeling well and continues his normal duties, which of course is encouraging. He's still in charge. Now, we've been through this in the United Kingdom. Our Prime Minister was gravely ill, actually, with COVID-19 back in March, and the Deputy Prime Minister had to take over for a period of time, or one of the Cabinet Ministers, for a short period of time. Fortunately, he seems to make a full recovery, but it does give a lot of uncertainty in the country, so I understand that it's an uncomfortable situation at the moment. But let's look at the likely outcomes as well. So this is the paper that we've got here. This is the latest paper from Australia. Now, this is a meta-analysis. Now, most of you will know, but a meta-analysis takes data from many different studies, combines it all together, so you end up with a much bigger data pool to get your data from than you would if you were just looking at one single study that might be carried out by one single university, for example. So this is an accumulation of data that's then reanalyzed. And what we want to look at today is the probability of deaths at various ages. That is the key thing. And just before we do this, I think I want to point out that I re-looked at the footage of the presidential debate a few days ago. Now, before that, the candidates did test positive, but I estimated they were only about 10 feet apart. And when you're talking a lot like I am now, you're producing a lot of aerosols, and they can spread in the air, and they can stay in the air, and they can diffuse out through the air. So it's not impossible, as I understand the physics and the biology of this, that Mr. Biden could have been potentially infected as well at that time, if the president was infectious, which is currently unclear. Certainly is at risk, and of course Mr. Biden is slightly older than Mr. Trump, so the risks are there, and we'll quantify those risks now. Now, so that's this meta-analysis. Now, the objective of this study, carried out in Australia, just published a few days ago, published a week ago. The objective is to determine the age-specific infection fatality rate. So the infection fatality rate is the IFR. It is the infection fatality ratio. It is the number of people that die compared to the number of people that get infected, and we usually express it as a percentage. So let's look at what that's likely to be for the age group of the president. So the methods, 111 studies, 33 locations. So this is pretty big scale data, so that's good stuff. Carried out by reputable Australian academics. The other thing I always do on this channel is post the links. So you can always click on it yourself, because I don't want you to take my word for anything. I can get things wrong. Go back to the original source. Have a look at it. This is my best interpretation of the original source. Now, the results give estimated age-specific infection fatality rates. So of 100 people that catch the disease in a particular age group, what is the probability, quite brutally, to put it quite frankly, what is the probability that that person is going to die? So based on wide-scale data, this is kind of the best figures that we have at the moment from this meta-analysis. Now, the good news about this virus is that it's very low for children and younger adults. Remarkably low. Now, we're fortunate this virus could have selectively killed our children. We're fortunate that the biology of this virus is as the biology of this virus is, and it's more likely to kill older people. Now, this is tragic, but it would have been even worse if it was a more virulent virus that killed more young people. So in a sense, we've been fortunate with this pandemic. That's one of the themes that I've been talking about for a while, because another one could come along where we're not. Anyway, straight on to the business. It increases progressively with age, and actually, if you look at the log scale of this, it's a bit mathematical, I don't fully understand it, but the log scale is a straight line. So it gets progressively older with age. That is the key thing. The increase in death dramatically increases with age. So at the age of 55 years, the probability of dying from this disease, combined data sets from all these different countries, the 111 studies, the 33 countries, is 0.4%. 0.4% at the age of 55. And of course, men are at greater risk than women, but as you get older, that kind of tends to balance out a bit as well. So these are overall figures for both sexes. So for 55-year-olds, the chances of dying from COVID-19 infection, from the data we've got at the moment, is 0.4%. Now, if anything, it's likely, having read this paper, that these are overestimates. I'm hopeful that that's going to be nearer 0.3%. I hope for even 0.2%, but it could well be 0.3% because of the amount of testing and the amount of information we get from things like serological surveys. We always tend to underestimate the real number of cases because 20% of people are asymptomatic, of course. On average, roughly 20% of people are asymptomatic. More so in younger age groups. Right, by the time you get to the 65-year-old age group, the chances go up to about 1.3% of death. The president is 74, so his chances of dying according to this data are 4.2%. Now this sounds fairly brutal, we're talking about people's lives here, but the more information we have, the more prepared we can be. So I think it's appropriate to do this. In other words, it's about 96, isn't it? 95.8% chance the president will make a full recovery. So it's overwhelmingly likely he's going to make a full recovery based on this data. Having said that, the president is somewhat overweight. Having said that, he's a non-smoking teetotaler. So, you know, there's sort of pros and cons on both sides. Now, with increasing ages, 14% to 85, 25% in the over 90s. So that's kind of the way it goes. Mr. Biden being slightly older, if he was unfortunate enough to catch the condition, just a slightly increased chance over the president, Mr. Trump. Right, discussion in this paper, public health measures to mitigate infections in older adults could substantially decrease total deaths. This is the idea of guarding. We need to guard our older people. And at the moment, Mr. Trump and Mr. Biden are in the older age group. There's no question about that. Now, how does this compare to seasonal flu is a question I'm constantly asked. So just to take one example, seasonal flu, winter of 2018-2019 in the United States, 63 million infections. Very, very common. 34,000 fatalities. That gives a case fatality rate of 0.05, 0.05. I'm not writing this down for you, I'm writing it down for me because I sometimes get the numbers mixed up. So we can see that it's about 10 times, COVID-19 is about 10 times more deadly than seasonal flu. Right, now what are the implications for this? What will need to be done? Now, fortunately, the Centres for Disease Control have got this protocols for this, which of course will be followed in this case quite meticulously, I'm sure. And one of those is tracing the contacts. And of course, the implications here are huge. We are at the heart of government here. Contacts have been made. Disease could have been passed on because, of course, this disease is infectious before it is diagnosed. It is infectious before it's symptomatic. And as we know, the president was diagnosed as a result of testing, not because he became ill. But we understand that the president and Melania are both, the First Lady, are both well at the moment. But what needs done? COVID-19 contact tracing. Time is of the essence here. because people need to be contacted so that they can be advised to isolate and not spread the disease further, regardless of whether they're feeling ill or whether they're not, because the disease can be transmitted in asymptomatic people and pre-symptomatic people. So Centers for Disease Control, Mr. Trump will have to remember everyone he's come into contact with, and I'm sure he'll have some help to remind him of that, so a list will be drawn up of everyone he's come into contact with over the past infectious potential period of time, over the last week or two, probably over the last week. Contact tracing, warning exposed individuals so they can isolate. Exposed individuals are the contacts they can isolate. The Centers for Disease Control believes in protecting patient privacy. Contacts are only informed they may have been exposed, not who gave them potentially the infection. Contacts are provided with education, information and support. Contacts are encouraged to stay home 6 feet apart from anyone else for 14 days. Monitor themselves by checking the temperature twice daily, but we know that perhaps less than half of the people who get this disease will get a temperature. Very often it presents with headache and fatigue as the initial symptoms. Look out for cough and shortness of breath, which would be more characteristic. And the one that the Centres for Disease Control doesn't mention here that's always worth testing is what we call anosmia, when the patients lose their sense of smell. So it's always worth seeing if you can sniff the coffee. If you can sniff the coffee, it doesn't mean to say you haven't got it, but it's worth checking that. There I am. Right. Contacts who develop symptoms should promptly isolate themselves, notifying public health staff because they'll be infectious. Promptly evaluated for infection and for the needs for medical care. So everyone should be evaluated. So that all needs to be done as per the Centres for Disease Control protocol. Now, just before we look at the care of a sick person at home, we'll just review what's going on in the States at the moment. Always good to go to the live data. This is the live data. These colour changes here are the increases in the last 7 days. So as we see, California, Texas, California there puts the figures up for you, Texas, Florida, these states have been a problem for a while. And of course, I always include the link so you can click on this and get it bang up to date for yourself. What's changed in the United States over the past little while is the increasing cases in the Midwest. Wisconsin, where with increasing cases, Illinois, for example, with increased cases, and not too far behind in Minnesota and Iowa, Missouri. So that's worth looking at. Now, thankfully, the hospitalisation data is not too increased at the moment. So this was the hospitalizations at the peak of the pandemic back in April. And now this data is somewhat out of date, but this is live. So this was up to date as of the 19th of September. So we're expecting another week's data, hopefully any time now. But what it shows is we don't have the increase in hospitalizations we had at the peak of the pandemic. This is probably largely because the proportion of people that require hospitalisation might be 4 or 5%, and the numbers of people actually infected way back in March, April, May were way higher because the testing was nothing like as widespread as it is now. But that's firm data there. The hospitalisations, thankfully, relatively low. And the other thing that's good on this data here is we can actually go on to trends. And we can see trends, hopefully. So here's the number of cases in the United States. And we can also soberingly go on to deaths. And unfortunately, we see the number of deaths in the United States has stayed reasonably constant for a period of time. So lots of data you can look at there, maintained by the Centres for Disease Control. Do click on that, look at it, and you can find lots and lots of data on many things there for your perusal. Now, the other thing we've looked at quite a lot of detail on this channel is the reproductive number, the R value, And if you've watched before, you'll know, you probably know this anyway. The R value is the average number of people that any one infected person will infect. So if the R number is 1, on average, one person will infect 1 new people. So the number of cases will stay the same. If the R number is 2, then on average, every infected person will infect 2 people who will infect 2 people. And then we have what we call exponential growth. The numbers will just take off with this doubling process. So for the numbers to be going down, we need an R value of less than 1. And that's what this gives us. This gives us the lifetime RT value in the states. So all of these states here, the numbers are increasing. Now this does not relate to the overall numbers. It relates to the rate of increase. So even though someone's got a state might have a very small number of cases, if that small number of cases is increasing, that will give you this larger R value, because it's the trend where we're going here. Because it doesn't take long until this disease is doubling every 5 days or something, if it's left unchecked. So that's the data from the different states. And again, you can look at this, the links there. Florida, we've noticed, has just gone into the red. It's gone up to 1. It was 0.95 just yesterday, I think. We did notice that there was a quite dramatic easing of restrictions in Florida just a few days ago. And we did anticipate that the R0 in Florida would go up as a result of this, and unfortunately I do expect the R in real time, the RT in real time, to go up more in Florida, illustrating the importance for Floridians to take precautions. So in all these states here, the numbers are actually increasing. It's only these states here in the green where the numbers are going down. So that's what we call the effective reproductive number. So that is useful data. Now, the Centres for Disease Control publish useful data for care of people at home. So I thought that might be worth having a look at as well. This is direct from the Centres for Disease Control website just this morning. So Mr. Trump and Melania are at home, the First Lady, at home in the White House. So this is what they'll need to do according to the protocols, as well as the self-isolation, of course. Having a sick person at home. Many people who get sick with coronavirus can be safely cared for at home if possible. Have the sick person stay in one room or physically away from others. Other people in the household, keep them at least 1 metre an arm's length apart, away from each other. So that's just over 3 feet, isn't it? Okay, so that's one piece of advice. I think the good thing about the White House is I'm sure they've got spare rooms. So this is easier if you live in a bigger house, obviously, to isolate yourself from others in the house. If you live in a nice chateau in the countryside, the sick person can just go into the East Wing and be isolated up there. Not so hard for most of us that live in more normal accommodation. So wearing a mask, having the sick person wear a mask or cloth face covering when they are around other people, including family members. Caregivers should wear a mask or face covering and disposable gloves when touching any item used by the sick person. If disposable gloves are not available, be meticulous about hand hygiene. Washing your hands, as you can see, is a good idea. Doing it properly. Disinfecting surfaces, because the infection can go from the infected person onto a surface and be picked up by someone else. And I noticed that the hotline number is not there. And this is directly from the Centres for Disease Control this morning. So I assume you have localised hotlines in the United States. I guess that's the way it works. But the Centres for Disease Control also point out these sort of red flag symptoms: trouble breathing, confusion, chest pains. Then don't hesitate to take medical advice. So that's the up-to-date guidelines from the Centres for Disease Control. These are all the links if you want to check on all my sources, because I don't want you taking my word for things. There we go. They're all there. They're in the links. So that is the situation from the United States at the moment. Now, I have got other news from the UK and everything, but I think we'll post that as a separate video for now. And we'll just finish with a few pictures from Danette, who's in Humboldt County. because there's still fires in California. I mean, it's just been appalling. You know, the United States has had the COVID-19, it's had the hurricanes in the Gulf and on the East Coast, and then West Coast, in fact all up and down the West Coast, California, Oregon, Washington State. So much trouble with fires, and still fires in California. And here we see the smoke in the sky over Humboldt. So thank you for that, Danette. And again, these are taken in daytime, so the smoke has been a problem, and we've looked several times on this channel at problems caused by the smoke itself. And let's finish with a message from Dr. Mark Jones, who's advocating the use of vitamin D, as indeed we have discussed many times on this channel. Thank you for watching. If you want more news on the UK and Europe, do click on to the next video. And there's also some concerning things from the UK and Europe that I do want to bring up, but we'll leave that as a United States video for now. And we wish all our friends in the United States well. And regardless of your political opinions, anyone who is sick, I don't care who they are, from the highest to the lowest in the United States, I wish them well.